I'm Martha McCallum.
And I'm Brett Baer. We are just hours away from voting in what some people are calling Super Tuesday 2.0. 6 states will decide on their choices for which Democrat should go up against President Trump this fall. 352 delegates at stake.
The fallout from last week's Super Tuesday voting has left us with a two-man race. Former Vice President Joe Biden riding the wave of an incredible comeback. Biden surging in 2 polls here today in Michigan against the former frontrunner, Vermont Senator Bernie Sanders, the self-described Democratic socialist who is feared by many in the Democratic Party establishment.
Tonight, we get a second opportunity to talk with Senator Sanders about what he believes and what direction he wants to take his party and the nation.
Ladies and gentlemen, please welcome Senator Bernie Sanders. Yeah. You're welcome. Good to have you. Thank you very much for being here, Senator Sanders. We just want to mention that obviously there's the coronavirus situation going on, and President Trump is about to speak from the White House about the task force, and you are able to see that streaming right now on Fox Business and it's streaming, I should say, on FoxNews.com and on Fox Business. So with that in mind, let's start and dive in here with our first question this evening. Welcome again, Senator Sanders, which comes from Mahdi, who is a supporter of yours. Mahdi.
Good evening, Senator Sanders. The coronavirus has quickly become a public health threat with a global reach, and infection and death rates are rising here in the United States. What is your assessment of the Trump administration's handling of the outbreak, and what would you do differently?
Good. You don't mind if I stand here?
Not at all. Your choice.
All right. Sadly, we have an administration in Washington that has shown the world that it does not believe in science. Its attitude toward climate change, which it thinks is a hoax, is telling the whole world. How do we trust this administration dealing with an international crisis, healthcare crisis of the coronavirus? When you appoint Vice President Pence, an individual who also doesn't much believe in science, what you're telling the whole world is that we're politicizing this issue rather than dealing with it from a data research scientific basis. So first of all, this is what I would do. You need scientists leading the effort, not politicians. This cannot be in any way, shape, or form perceived to be a political issue. Number 2, we will talk, I am sure, about Medicare for all. Yes, but when I talk about health care being a human right and all people having health care, the coronavirus crisis makes that abundantly clear as to why it should be. You got millions of people in this country today who may feel that they have a symptom, but you know what? They cannot afford to go to a doctor. And then they're going to go to work. We have a president of the United States, doesn't matter, go to work. We have a president who says absurd things. So what we need to do is right now make it clear that all Americans, if you are feeling sick, go to a doctor. It will be paid for. Don't hesitate to go to the doctor. I'll give you another example. As all of you know, or should know, we are the only major country on earth that does not have paid family and medical leave. So what does that mean in practical terms? When half of the people in this country are living paycheck to paycheck, today you're feeling sick, maybe you're coughing, maybe you have a fever, but you know what? You got to get to work. You got to go to your job at McDonald's or Burger King or Walmart, because you don't go to work, you don't get a paycheck, you don't get a paycheck, you don't feed your family. What happens if you have that virus and you're going to work? You're spreading it to other people. So right now, while we move to make paid family and medical leave national policy, at this moment at least, we say to every worker, if you are sick, stay home, and we will figure out a way to make sure that you are compensated and get your salary so your family doesn't suffer.
Senator Sanders, to Mahdi's point, to Mahdi's question about what you would do differently. Standing around the president right now are a lot of scientists, Dr. Tony Fauci, and the head of the CDC, a lot of experts. Good. Would you not have those experts?
Of course I would.
Well, what would you do differently to his point?
But here is the point. I would not be a president saying to the world, oh, by the way, was he on Fox saying this, right? I have a natural ability to understand the problem. Is that true or not? But,
sure, I think he did say that, yeah.
All right. He doesn't have a natural ability. I mean, You don't.
He said that to all reporters at the CDC. But
I understand that. All right, but my point is, for a start, as a president, I don't claim, if I'm president, that I'm the world's greatest scientific expert on climate change or coronavirus. You listen to the scientists. You don't say stupid things. You don't suggest to people that you can go to work. That's not what the scientists
Okay, well, let's talk about the economy. The markets dropped.
What, we're not talking about coronavirus anymore?
We are. This is to deal with coronavirus. The markets dropped 2,000 points.
I always give this guy a hard side, you know.
You do, but
because I remind him he's on Fox Television.
Okay.
He forgot about it, but I wanted to remind him.
We'll be fair. The markets dropped more than 2,000 points today based on the virus.
Yeah.
Airlines, cruise lines, hospitality industry obviously taking a big hit. What if those companies needed a bailout to stay afloat and avoid losing thousands of jobs? As president, how would you handle requests by American companies for a bailout?
One of the differences, if I might say, between Joe Biden and myself is that Joe bailed out the crooks on Wall Street who nearly destroyed our economy 12 years ago. I'm using the word crooks. You're not, right?
That's true.
Okay.
This is going to be fun tonight.
You did use the word. That's correct.
I used the word. Okay. And these guys, after destroying the economy, they came to Congress, and they hate, they oppose, they want to cut Social Security, Medicare, and Medicaid, many of these Wall Street executives. But they came to Congress and they said, bail us out. And what I said at that point is, I understand the economy is in trouble. And if you want a bailout at a time of massive income and wealth inequality, that's fine. Go to your billionaire friends and we'll put a special tax on billionaires to bail out the economy. And it wasn't only the TARP funding, it turned out to be trillions of dollars in zero interest loans. So my answer right now is we will take a look at the economy. Obviously, we don't want the economy to tank. But when 3 people in America, Brett and Martha, own more wealth than the bottom half of this country, when 49% of all new income goes to the top 1%, when we have more income and wealth inequality than any time in the last 100 years, if we need to bail out the economy, you know who does it? The people on top, not working class people who are struggling today. And number two, when we talk about bailing out the economy, this is not going to just be more tax breaks and subsidies for large corporations. You want to talk about bailing out the economy? Let's provide health care to all Americans as a human right. How's that? Let's talk about raising the minimum wage to a living wage of $15 an hour. So you talk about bailing it out. If it's simply helping the people on top with taxpayer money from the middle class, no way.
Let me ask you two questions that are part of one. The first one is you've talked about raising taxes on corporations, raising taxes on Americans to some extent as well. Would you, if you were in the Oval Office today, given what's going on in the economy right now, concerns that perhaps there might be a recession coming, as some people suspect could happen as a result of all this, would you hold off on raising taxes while that situation is going on?
Well, what I would do, no, I think raising taxes does 2 things. Number one, it is one means of dealing with a grotesque level of income and wealth inequality. All right, I don't believe, Mike Bloomberg, as you know, was running for president. In the last 3 years under the Trump administration, his personal wealth increased by $15 billion. And I think that that's absurd. So I think one thing you do with progressive taxation is you say to the wealthiest people in this country whose wealth is exploding, while we have 500,000 people sleeping out on the streets, including 30,000 veterans, where we have kids who cannot afford to go to college, we're going to ask the wealthiest people in the country to pay their fair share.
With respect, can I just, because you're answering that question, I think, the same way that you would have answered it a month ago before the virus happened. But I'm asking you, in the middle of right now, when we are potentially in an economic crisis, you've got all these companies that are halting conferences and cruise ships and all these things. Would you say, but you know what? I still believe that in this moment we need to raise taxes.
I will not become president until January, and the economic situation will be different than it is today.
If you were there today in this moment,
if I was there today,
would you raise taxes today?
What I would there, well, again, I would raise taxes on billionaires for dealing with the issue of income and wealth inequality and raising the funds we need for education, environmental protection, and homelessness. But in terms of an economic stimulus, which I think is what you're talking about, we have an infrastructure today which is crumbling right before our eyes. We have millions of people spending half of their income on housing in this country. So what I would do is invest in working class people in good paying jobs by rebuilding our crumbling infrastructure, roads, bridges. I don't have to tell the people of Michigan, who have lived through Flint, Michigan, about a horrible water system.
All right, but one more question with regard to billionaires. Bill Gates is coming up with a home test kit that he's going to give out all over that area. Other billionaires who are at pharmaceutical companies are putting, the pedal to the metal to try to find treatments and vaccines. So there are good things that billionaires do in a time of crisis, right?
Martha, but take a step back. I understand that. And I'm not here to demonize anybody. I really am not. I have nothing personal against Bill Gates, who has done many good things in his life. His foundation has done good things. But don't you think it's a bit absurd that in the wealthiest country in the history of the world, we have to depend upon the generosity of billionaires to help us? We should be too.
Okay. We're going to move on. We're going to move on to the next audience question. But if you had to, would you close down the borders?
No. I mean, what you don't want to do right now, we have a president who has propagated xenophobic anti-immigrant sentiment from before he was elected. What we need to do is have the scientists take a hard look at what we need to do. There are communities where the virus is spreading. What does that mean? It may mean self-quarantining. It may be not having public assemblies. But let's not go back to the same old thing. Isn't it interesting that a president who has been demagoguing and demonizing immigrants, the first thing that he could think about is closing down the border? So we need scientists to tell us the appropriate approach, not a political approach.
Okay, let's turn to an audience question. Allison? Allison? Yeah, go ahead.
Hi, Senator Sanders. So to some people, you're seen as too liberal. It seems like you have the right ideas, but to most moderate Democrats, it seems like Joe Biden could get more accomplished in office. So how will you ensure that you can accomplish all of your goals in office and leave the country in a better place after 4 years?
Thanks, Allison. I reject the idea. I really do. That's one of the things that bothers me. I hear it every day. I hear it on the media. I hear it from my opponents. Bernie is an extremist. Bernie is too radical. Okay, let's deal with it. Is raising a starvation minimum wage of $7.25 an hour, which has not been raised in 10 years, to $15 an hour, a living wage, a radical idea? No. Is making public colleges and universities tuition-free so that all of our people have the opportunity to get a higher education in a competitive global economy, is that a radical idea? No. Is doing what every other major country on earth does, guaranteeing health care to all as a right. I live 50 miles away from the Canadian border. This is not a communist society up there in Montreal. They guarantee health care to all. They spend 50% of what we spend. Is passing a Medicare for all single-payer system a radical idea? No! And last point, Donald Trump, I know he's on the network a whole lot. Donald, you're probably watching. How are you? All right, I know. Wanted to say hello to the president.
He's actually giving a news conference.
Oh, is he? I'm sure he's watching Fox on the side there. He's kind of addicted to your station. Trump thinks that climate change is a hoax. And that's because he doesn't understand or respect science. I believe that climate change is an existential threat to this planet. I will listen to the scientists who tell us that we have got to move aggressively to transform our energy system away from fossil fuel to energy efficiency and sustainable energy. And through a Green New Deal, by the way, we can create up to 20 million good-paying jobs. So my point is, I appreciate Allison raising the question. I just don't think any of those ideas are radical.
All right, let me ask you, just back to Allison's question, which was, how you would get things done in Congress when there are a lot of folks who don't agree with all the ideas that you just mentioned. And here is one of them. This is Hillary Clinton. She talked about you in a documentary that was released earlier this week. Watch this.
Bernie just drove me crazy. He was in Congress for years. He had one senator support him. Nobody likes him. Nobody wants to work with him. He got nothing done. He was a career politician. He did not work till he was like 41, and then he got elected to something. It was all just baloney, and I feel so bad that, people got sucked into it.
Wow, that's strong stuff. What's your reaction?
Unlike Secretary Clinton, I don't want to relive 2016. We're in 2021. But what I would say, on a good day, my wife likes me. But also, if you guys look at some of the polling that they do for United States senators, they do polls, how popular you are. In most cases, I turn out to be the most popular United States senator in the whole country. So 1 or 2 people most likely.
Senator, President Trump continues to tweet. He continues to tweet even today that the Democratic primary race is rigged against you. He said the same thing in 2016. So do you agree with President Trump?
Well, given the collapse of the stock market today, given the spread of the coronavirus, one might think, to tell you the truth, that a president of the United States would be worrying about some other things rather than the Democratic primary. But maybe I'm wrong on that. Look, Trump has his agenda, and I have the feeling that deep in his heart, he's really not all that worried about me. I appreciate his concerns. You will forgive me if I don't necessarily trust him or believe him. But I will say this. He has some very smart political consultants around him. And a couple of weeks ago, a political consultant, somebody asked him, well, who would you rather run against, Sanders or Trump or whatever? And what the guy said, I forgot his name, he said, you know what? Running against a movement makes me nervous. Because they understand that our campaign is more than just a campaign. We are creating a multiracial, multi-generational political movement of young people, of working people, of people who believe in justice all across this country. And in his heart of hearts, I think that is what makes Trump very nervous.
Let's talk about the economy. Jonathan is an undecided voter, I believe, and he has the next question. Jonathan?
There he is.
Where's Jonathan?
There he is.
Okay.
Hi, Senator Sanders. If you were met with an obstructionist Congress, what compromises would you be willing to make to still promote your chief policies?
I didn't hear the last part of the question.
What compromises would you be willing to make to still promote your chief policies?
To promote it.
In other words, if you have a Congress that doesn't agree with you,
Yeah.
what compromises would you make to get it across the finish line?
Look, I should tell you, I know that there's another mythology going out around me that everybody hates me. We heard that from Secretary Clinton, that I can't work with anybody. Check the record, and you'll find that in the 1990s, when I was in the House, I passed more roll call amendments on the floor of the House, bipartisan, than any other member of the House, year after year after year. So in other words, when we see people who have common interests, I don't care what party they're in. For example, there were and have been and are today a number of Republicans who are outraged that we are spending 10 times more for prescription drugs, same prescription drugs than people in other countries. That we're getting ripped off day and night by the collusion and price fixing in the pharmaceutical industry. There are Republicans who want to address that. I will work with them on that issue. There are Republicans who know that our infrastructure, roads, bridges, water systems are collapsing. I will certainly work with them on that. I worked with Mike Lee, Mike Lee of Utah. Mike and I, was a very conservative Republican from Utah. Mike and I worked together to pass for the first time under the War Powers Act a Senate resolution getting the United States out of the horrific war in Yemen. All right? Mike Lee, a conservative Republican, and I worked together on that. I worked with the late John McCain, who was a friend of mine. We had different points of view, but I respected John immensely. John and I worked together when I was chairman of the U.S. Senate Committee on Veterans Affairs on perhaps the most comprehensive veterans bill passed in modern history. So the idea that I cannot work with Republicans on issues where we can come together is just not accurate.
All right, so a lot of the questions that deal with trying to pin you down on specifics about,
all right, go for it,
how
Brett.
you're going to pay for your programs.
Good.
Now, several economists have really tried to calculate the cost of the total list. I'm talking Medicare for all, Green New Deal, free college, housing, all of it
Not free
together.
college, public colleges and universities.
Understand the caveat.
Harvard will not be free on my
Estimates put it at a staggering $55 trillion with a T over the next decade. Now, it's hard to describe that much money, 55
a lot
trillion.
of money.
All right, so just give me a second. Here's 1 second. 1 million seconds is 12 days ago. 1 trillion seconds is 31,689 years ago. That's $1 trillion. You're talking $55 trillion. Hold on. If entirely covered by taxes, it would be nearly double the existing level of taxes. If entirely covered by borrowing, it would soar the national debt to $78 trillion. Now, the national debt is $23 trillion right now and counting. So, how can you pay for all this?
Good. All right. Now, I don't have the teleprompter. All right, but I'll do my best. All right.
I was to get the numbers right.
Okay, good question. All right, let's deal with it. Fair question. Bernie, you're proposing bold ideas. How are you going to pay for them, right?
With a big price tag.
Yes. All right, let's deal with them. Medicare for all. How are you going to pay for Medicare for all? Fair question. How are we paying for it right now? We're paying for it right now by spending twice as much per person as the people of any other country. The average family in America makes approximately $60,000 a year. They are paying $12,000 a year, 20% of the income for health care. Their employer is paying even more. So what I propose is, instead of you, an average worker, paying $12,000 a year, what we are going to do is eliminate all premiums. And now let's be fair about this. Sometimes we're not fair on television. All right? Premiums are gone. Got it? No one's paying any more premiums. No one's paying any more co-payments on the Medicare for all. The absurd concept of a deductible is gone. All right? We're going to lower, because we're going to end the greed and collusion of the pharmaceutical industry. Nobody under my plan pays more than $200 a year for prescription drugs. Okay? All of that. Got that? No one's paying that. Then I say to you, look, health care is not free. I'm not suggesting to you it is. You're the average worker. You're making $60,000 a year. What I say to you, there are various options out there that we put on our website. Number one, we have proposed a 4% income tax on you, exempting the first $29,000. So people making $29,000 or $1,000 or less don't pay anything. But that would mean that you would pay 4% of $31,000. That's $1,200 a year. You know what, guys? Comprehensive health care under my Medicare for All plan, by the way, that includes dental care, hearing aids, eyeglasses, and home health care. $1,200 a year is a pretty good deal, it seems to me. That doesn't cover it all. That does not cover it all.
Not nearly.
What we impose is a 7.5% payroll tax on employers. That will save employers money. And then through progressive taxation, we fund the rest.
How much does all that add up to?
Okay, here we go. Give me a minute.
Okay.
All right. He took a minute. Give me a minute response.
Sure.
Okay.
Take it.
Right now, the estimate is from the Department of Health and Human Services that over the next 10 years, this country will be spending about $50 trillion. Got it? $5 trillion a year. Okay? According to recent studies, Medicare for all will save money because we're doing away with the profiteering of the insurance companies and the drug companies. And here's the main point. Right now, we have to, as a nation, administer thousands of private insurance plans, which cost a fortune to do. Do away with that because you have one broad plan. You can save some $400 or $500 billion. So to answer your question, right now, the federal government, through Medicaid, Medicare, and other public health programs, we're spending about $30 billion a year. We think you'll need about $47 billion to fund what I want to fund. That's $17 billion more, and it comes through the mechanisms that I talked about.
This is just Medicare for all.
That's just Medicare for all.
There's a long list.
There is a long list. But here's the point. We have documented, and it's a fair question, guys. I got it. We have documented how we do pay for that. Let me go to free tuition in public colleges and universities and canceling all student debt. How do we pay for that? We pay for it through a modest tax on Wall Street speculation. That's how we pay for it.
But you're going to also, everyone is going to have to increase their taxes. Last time we talked, you said, yeah, probably middle class will also see their taxes go up. You also talk about cutting defense spending. When you look at defense spending, we've spent $6.4 trillion over 19 years in Iraq and Afghanistan. If you said, I'm not going to spend $1 after that, you wouldn't even come close to making the money back if you cut defense spending to cover the plan that you're talking about at $55 trillion.
All right, but one second. All right. If you look at what I'm doing issue by issue, I told you how we would fund Medicare for all. You're saying, and this is where we need from media kind of honesty and respect in this sense. No, I'm not beating up. No, I am not beating up on these guys.
Well,
I am not.
We're just looking at
I am not beating up on you.
I mean,
all that I'm saying.
You have your estimate numbers. We have
it's not even the numbers.
Well.
Martha, here's the point. This is not
numbers. It is.
No. All right. Well, here's numbers then. If right now you're the average worker, okay, you're paying $12,000 a year for health care. And if I said to that worker that I can provide better health care for substantially less, but you'll have to pay more in taxes, I admit it, okay? So let's say you pay $1,200, $2,000 more in taxes for comprehensive health care, but you're not paying $12,000 in premiums, co-payments, and out-of-pocket expenses. Who has the better deal?
Well, that may be true for the $12,000 a year person. For the $30,000 or $40,000 a year per person who likes the health plan they have from their employer, there's 180 million Americans who have coverage that they like, but you're going to take that away from them.
No. First of all,
No?
it's 150 million, and this is what we're doing. Every year, do you know how many people lose their health insurance every year? Because they lose their job or they transfer or whatever may happen, they quit.
Definitely.
About 50 million people a year lose their health insurance. That's true, okay? What we are doing is what every other country on earth does. Why do you think it's a great, I'm pointing, I don't mean to be argumentative. I'm looking at you, I don't know. But it could be many of my Democratic opponents, the same thing.
Sure.
All right. Why do you think that it's a wonderful idea that employers in this country are burdened with the cost of health care? Why is it that
they would probably agree with you. They'd probably not want to have that burden.
That's
but
right.
It has covered a lot of people in the country. Yeah.
Look, you're a small business person. You're a decent person. You got 10 people working for you, right? You want to provide health care. It is enormously expensive.
It is.
All right?
Absolutely, that's true.
So every other country has said, you know what, you're a small businessman. Do your damn business. Don't worry about health care. We will cover all health care for you as a human right. So I think, I just want to end on this note. And the coronavirus makes this point. We lose conservatively, guys, about 30,000 people every year. That's conservative, who die because they don't get to a doctor when they should. That's a tragedy. But you can see the absurdity of the current system today when people cannot afford to go to the doctor who may be struggling with the coronavirus. I don't know how anybody can defend the system where we're spending twice as much per person, and yet you got 87 million uninsured or underinsured. It is an indefensible system unless we worry about the healthcare industry, which made $100 billion in profits last year.
Senator, we gave you the time, and we want to give many more questions to come, including the Green New Deal and socialism.